Good evening. I'm quite pleased to introduce our first speaker tonight, Dr. Shehan Silva. Dr. Shehan Silva is a senior lecturer in medicine of the University of Sri Jayawardenepura. He also serves as an honorary consultant physician at the professorial medicine unit of the Colombo South Teaching Hospital. He graduated from the University of Sri Jayawardenepura. So, on a personal note, he's one of our students, one of the best students, and he has been a colleague with me in the Department of Medicine. His interests include geriatrics, frailty, sarcopenia, palliative care, non communicable diseases, medical humanities, professionalism, and ethics. Dr. Shehan will speak to us tonight. His topic is Citadel by A.J. Cronin. So, over to you, Dr. Shehan.
President of the Ceylon College of Physicians, Duminda Munidasa, ladies and gentlemen, my teachers and my colleagues, a very good evening to all of you. First of all, let me thank you, Madam Professor Pamni Manigasuriya, for that lovely introduction. I'm delighted to talk today at the CCP Book Club. And I hope I will do justice to the cause of this program, this event that has been going on since last year. And talking about this, the book club, my most favorite physician from the past, if God would give me a chance to meet somebody from the past, I would like to meet this person, William Osler. He said, start at once a bedside library, spend the last hour of the day in communion with the saints of humanity. He was quite a good proponent of this. And we have Anton Chekhov. We hardly know about him that he is a doctor. We know that he is a writer, visited Sri Lanka, Ceylon at that time. And he says, medicine is my lawful wife and literature my mistress. When I get tired of one, I spend the night with the other. The problem comes when you have the wife, the true wife, and the mistress, literature, in the same room in the night. And this is what comes about. So, sometime in the future, when my better half becomes a little bit older and wiser, Tushara, you might get a call like this. The stacks of books on his bedside table that he's been intending to read for years fell over and crushed him. Right. So, bibliophile. So, over to the topic, and before that, about the author of this book, this wonderful book called Citadel. It was written by Archibald Joseph Cronin. He himself was a doctor from Edinburgh, graduated from Edinburgh, worked in Wales. Unfortunately, he was stricken with peptic ulcer disease, and it was an illness which was quite difficult to treat then. And then he could not practice medicine, and then he entered into a lifelong journey, a lifelong profession of writing books. And indeed, some of you would have written some of these books of his from yesteryear. This book, Citadel, which was put out in 1935, was one of his greatest works. And it says that in 1935, when this book came about, there were nine reprints over that year, because there was so much of a demand for this. And one source says that it was second to the Bible in circulation. Citadel, how I came across was just before I left for my foreign training to UK, I had a fatherly chat with Professor Senaka Rajapaksa when I was doing locums in the nights in a private hospital. And then he said, he just inspired me to reading into this, to get me reading into this book. I downloaded the PDF copy and I read it at that time. And now, when I was in UK, I bought this. Indeed, it's a book that inspires every time when you read it. It gives new thoughts, new hopes, new aspirations. Citadel, what people talk about about Citadel is that it was so influential that it paved the way for Anurin Bevin in 1949 to establish the National Health Service. I'm not going to talk about that. I'm going to talk about something else, about professionalism and about the life of a doctor. In fact, it was so well taken up that it came up in various forms of films as well as TV show, and even there is a Hindi film which was adapted based on the plot of this. So, however, with all these good thoughts about Citadel, it was not taken well by the medical fraternity, and there was some kind of ostracism imparted upon Cronin. And Cronin himself says, I have written this book with the feelings about the medical professional. Its injustices, its hidebound unscientific stubbornness, its humbug. The horrors and inequities detailed in the story I have personally witnessed. So it was actually a semi-autobiographical account. And he says that it was not an attack against individual, but against a system. And that paved the way for the establishment of the NHS. So in Citadel, we have a young doctor who just passes out from Edinburgh with flying colors, astounding record, and he had been awarded a bursary, a scholarship, because he was poverty-stricken. And he had this he had to pay back what he owed to that fund. So ultimately, his first job was to take up assistance job, a medical assistance job, in a remote mining village in Wales, just like what you see. And it was to assist a senior doctor. Little did he know that this senior doctor was incapacitated with a subarachnoid hemorrhage, and he was bedridden. So ultimately, Andrew Manson, the protagonist, had to work with the good name of that doctor, but had to ensure that he had to pay his dues to that doctor. So almost half of his earnings were given to that doctor's family. So that there was an injustice there. Manson tried to attempt to do his best by treating patients with full dedication, but he was having moments of victory and defeat, moments of diagnostic and ethical dilemmas. And he was able to plod on until he was confronted by the doctor's sister. And then he moved on. He moves on to another village in Wales, and he gets married to a teacher. And here again, he had to pay 1/5 of his salary to the chief doctor. There you see that there is an element of fee splitting going on. He had confrontation with miners who demanded false certificates, and he did not go into compromise. We'll talk about that later in our discussion. He loses many of them. But although in desperation and all this going on, he focused on his medical treatment of the lung disease. And he was engaged in research of pneumoconiosis and tuberculosis, and he ultimately attains a MD by thesis, and also achieves MRCP to become a qualified specialist physician. And over this course of this novel, he decides that he needs to move on, and then he has to progress. So ultimately what happens is he moves on to the famous Harley Street in London, where the elite, the best doctors in the country used to practice. And he was the physician to the elite, the neurotic. The word may be a derogatory word, but people who may be a little bit anxious, may be demanding. I'm reminded of the Peter Sellers and Sophia Loren's song, goodness gracious me, it would have been something like this. He was tempted with easy money, with the wealthy, the hypochondriac coming across his ways. And this affected him severely in his life. He was money-minded, and he was tempted with the worldly pleasures, the money, the worldly pleasures, as well as even goes on to committing adultery against his wife. However, he plods on, he gets tempted within the community, within the medical fraternity, and from outside the medical fraternity. We'll talk about that later. Ultimately, he ends up in the General Medical Council hearing, and he is questioned upon his work of being associated with a non-medical person in healing patients. So how does this word citadel come into this book? So citadel is a fortress. It is a fortified position. And you may consider that may be the place where he may be thinking that his ideals of practice of medicine ought to be. And he was looking forward to this citadel in achieving his heights. Just like Edinburgh Castle, where Cronin was from, Edinburgh, Cronin would have got influenced by the sight of that, and hence he would have used the word citadel in the term his citadel for his novel. But it's so strange that the word citadel cannot be found in the novel anywhere. However, there are themes of citadel, a thought of a citadel, a utopia, and a place which is higher ground always coming up. So there is always a conflict between idealism and materialism. Manson, the physician, the protagonist, struggled to hold on to the ideals of youthfulness, a battle that he often loses against materialism. Materialism that comes from the world, comes from the temptations that comes across through his patients, through his peers. But he goes on and he tries to aspire and tries to remain faithful to his ideals, the idealism. Another theme that comes about is integrity and hypocrisy. Manson is considered as a principled man, a man standing on higher ground, and he was based on his strong morals. And again, there were hypocrites. There his own best friend, who was his batchmate, study partner, comes off by saying various things about how he can take shortcuts in medicine, shortcuts in practice, shortcuts in becoming a so-called successful doctor. So Manson is very, very prompt at the beginning. He says that he liked his job, and that he was looking forward to working for the people. And at the time that he gets recruited to this Welsh doctor's practice, he immediately goes in the night to attend upon people who are sick, people who had typhoid, people who were dying of perforation of typhoid. And there are nice stories about how he was attending on births which ended up with birth asphyxia, but however, with his knowledge and skills, how he revived a child. And with that, he was able to do his practice. He also knew that he had to think about the body and mind dualism. In fact, he comes across a patient who has myxedema coma, myxedema madness, in fact. And the senior doctor certifies him as mad. And you know, at that time when somebody is certified as mad, that's madness for life, and they are put into an asylum. However, he confronts, he argues with the doctor and does his therapeutic trial of just instilling thyroxine, and the patient becomes well. So he thinks about that. So those are things for us to ponder in our practice. So at the time when he was recovering that child who was being asphyxiated. At the end, he says, I've done something. Oh God, I've done something real at last. And then he is in a state of triumph. Triumph, the summit of our practice. But Cronin brings about a very significant point just after that, where he is encountered with disaster, where his initial patient who he was treating with typhoid ends up dying due to a perforation. So you see, suddenly from the mountain, he is tossed down to the valley, and that is disaster or despair. And it's beautiful that in the film, when you watch the film, it's nicely portrayed, where suddenly you see that there are these Welsh people singing this beautiful Christian hymn, which is sung at funerals. Raise the fallen, cheer the faint, heal the sick, and lead the blind. I am vile and full of sin, but I have to strive to the truth and grace. I'm reminded of Kipling's famous if you can meet with triumph and disaster and treat those impostors just the same, rest you know. Something that I learned from this book, although the Eastern philosophy is not emanating directly from this, is about equanimity, where you have to think about having coolness and presence of mind under all circumstances, calmness amid storms. It's an appreciated concept, but often we misunderstand. In fact, we as doctors, we have to think about upekka, the Buddhist philosophy, the Brahmavihara of upekka. And recently I came across a comment that was put up by an eminent surgeon, Dr. Philip Virasinghe, who said, when you see a patient walking towards you, you have to radiate maitri to him, loving kindness. And when the patient is telling you what he's undergoing, you have to have karuna or compassion. And when later on the patient comes and says, doctor, I am being healed, then you have to have that empathetic joy, mudita. But most importantly, when the patient goes and tells the rest of the world, so and so healed me, you have to have upekha or equanimity. This book says that MRCP was the difficult exam, was a very difficult exam. Maybe the fact that at that time they had to learn the languages of Greek, Latin, and learn about astronomy, philosophy, etc. But on a personal note, all throughout my career from grade 1 up to MRCP was the most easiest exam, I would say. But he says, with all these things that he goes in his mind, he says it's the most difficult exam, it's murder, but I still believe, wait, I will get the particulars, and he indeed comes through with flying colors. One of the examiners asks him about his purpose of doing medicine. And it's not just telling that he is trying to help suffering humanity. Something that we all have said. We want to become doctors, we want to help humanity from suffering. But Manson quotes, I keep telling myself never to take anything for granted. That's the sole purpose of his practice. And because he said that, the examiner passes him with flying colors. Manson is encountered with a lot of conflicts, and he, as a young person, a young doctor, wants to tear down the walls of Babylon. And then a senior doctor comes and tells, you want to tear down the walls of Babylon? Well, I was young myself, but all the same, go slow, go easy, look before you leap. Do we give that, take that aptitude in our life? This is a article that I came across, 7 Ages of a Physician, written based on Shakespeare's Seven Ages of a Man. And I want to say certain things. This person who wrote this article said the medical school is like a phase where trials of and postgraduate medical education is taken up, but that's the point of the young stage. And then there is a justice who's round-bellied, maybe like us who are here, who may be achieving our successful careers in practice and industries, having pearls of wisdom full of source and modern instances. And then it comes to the lean, slippered pantaloon who tries to enjoy a quiet life, fruits of many years of success. And finally, the second childhood, childishness. In this book, there is a lot of talk about therapies that are defunct, therapies that are maybe considered of not bringing up any fruitful evidence-based outcomes. Things like nitro, which is a carminative or reduced substance that reduces the reflux, glycyrrhaptoin, irradiant lamps, iron therapy, various supplements. At that time also things were there, and things like needless tonsillectomies. And Manson's friends try to convince him to use these drugs or methods to treat their patients. It won't hurt them, it won't help them, but makes them feel they are being treated. I guess some of us, most of us, including myself, we subconsciously, consciously do this. Reminded of this, donta babakata denta deyak neta. When a patient comes to you and says and tries to get up and go, doctor, I have another problem. Then you try to get rid of the patient and then you quickly write something and get rid of that patient. There was professional discord among the doctors there, and there were fights where the doctors were fighting against patients being stolen from their practices. One of the cases, you stole from me your medical reverence, and you go on to have this professional jealousy going on. And Manson goes on to say, every doctor swears that practice is a dog's life. He drudges on, runs off his feet, always calls. Why is that? Because we don't have unity. There's no attempt at organization in our profession. I think that's something that we have to think about in these difficult times. And there is also exclusion where there is patient grabbing as well. For instance, Manson came up with a diagnosis of tuberculosis in a minor, and he referred that patient to a senior doctor. And the senior doctor says, look here, from now on, you don't need to come to the hospital. I will take care of him. You don't have to come. The reason that he gives it, he looks at his clothing, legging, hobnail boots. It's not going to work in the hospitals. So there is exclusion. We try to exclude our own people. There's also ostracism. At the end, Manson is encountered by his friends who turns back on him, and they say, we need to be careful with this man. He is threatening our own status, our training, our tradition. Very important word, tradition. The system. He threatens everything that we stand for. The only way of doing this, only remedy, is to ostracize him. And then he is being taken to the General Medical Council court, the preliminary council, for an event that happened in his professional life, for which he comes back victorious. I'll talk about that later. There is also a sense of being opportunistic. Unfortunately, when it comes to the middle of the novel, the protagonist Manson turns out to be the opposite character. He learns, he eagers the good things, what he generates out of shortcuts, and also by doing various unethical practices. And again, Manson's best friend says, "You're not getting all the juice out of the orange. You hang around with me and you will find your fruit more succulent." We yearn for more and more. There are gold diggers and free splitters in medicine. Gold diggers as in we may be having our own patients, our own clientele who we think are okay, they have a better standing, and we cling on to them and say, okay, because of them we have taken nuggets of gold out of them. We have treated them and we have taken advantage of that. There are instances where we split our fees between people who refer, maybe people, we bring people, we work as teams, and in an unethical way we may be generating this network of fee splitting. And there comes a point when Manson becomes a fee splitter and a gold digger, and Cronin nicely says he enjoyed receiving checks now. And to his extreme satisfaction, more and more of them were coming his way. We eager. The other thing is about gifts receiving. And you see that patients who are indebted to us, they come with some kind of a gift or some kind of a appreciation token, and they give it to us. But then when that gift becomes a vessel, an instrument which the patient might use as getting favors, or if we see that by that we are being compromised, that's the time that we have to think, okay, we should not receive gifts. There may be certain times when patients may come and give us gifts because of the sheer appreciation for taking care of them. But always we need to ethically question ourselves, is this right? Or is this beyond what our patient should be giving us? Association. Just like fee splitting, the mere fact that you associate yourself with another colleague, you see that there is, spread of patients, spread of clientele between each and every specialty. Here again, Manson's friend knows that now Manson is having a car, more qualifications, he's having worldly significance, and it is more profitable for him to be with him. So then he says, that's how we ought to do it. You and I, you really ought to be on it. And then the plot thickens. Manson being estranged with all these things about the succulence, and he's satisfied with the taste of all this money that is generated, and he says we've absolutely got a guilt edged everywhere, and we are making hoards and hoards of money, and we are rapidly getting rich. And he tells his wife that is the path to success. And the wife then reminds him, the conscience, don't you see you are falling a victim to the very system that you used to run down, the things that you used to hate? We compromise our beliefs, our very own practices. Don't you remember? Here now, this is the only place in the whole of this novel where Cronin talks about a city on a hill. Don't you remember how we used to speak of life, that it is an attack of an unknown assault uphill, that you had to take some castle that you knew as was there, but you couldn't reach the top. And then he keeps on running behind a mirage, and then he reminds himself that he has been not happy, and that he is in a state of delirium, craving for more and more every time he got it. And he says money, it was all dirty money. And then he questions himself, where am I going? Where in the name of God am I going? And suddenly he looks at the sack of money, the coins, the notes, whatever that he has collected over that day. And he throws it away in a hysterical sweep. And he feels that it is just a dull and senseless sound. There may be a point in all of our lives like that. I'm reminded of Charles Dickens' Christmas Carol, where the ghost of Jacob Marley comes in and he says, I wear the chain I forged in life. I made it link by link, yard by yard. I girded it on in my own free will, and I wore it. Is that pattern strange to me? Strange to you? Ultimately, in helplessness, Manson has thoughts of God, visits a church when he is cornered into a place where his license may be at risk. And then he thinks about things. Tribulation brought people to the thought of God, to the thought of a supernatural being, the thought of your own belief, your Dhamma or Logos or whatever you may believe in. Brought people to their senses, brought people to the thoughts of higher ground. And then his thoughts flowed outward in considered prayer and longed for his soul. God, don't let me be struck off. All of us, at the point of that summit, we forget our beliefs, we forget of the higher person, we forget our Logos, we forget our Dhamma or whatever. And then when we are cast upon that valley of despair, that's only the time that we think about our past, our God, our Dhamma, or whoever you believe in. And this is the same personal conviction that Cronin gives later on. He says that the compass of existence, it's like a compass which tells your conscience is like a compass which tells you the direction which ought to go. And he says the compass of existence is better than my textbooks, what I have learned from them. In short, I lost my superiority, and then I was not aware of it. And that when I was then aware of it, that was the first step in finding God. First step in finding your conscience, first step in finding your Dhamma, whatever. So it was a tight little trade protection, not really liberal enough, and we are trying to change what is outside us. The political scenario, the administrative scenario, but are we trying to change within us, within our profession? Being as physicians, it means the death of scientific progress. So there is serious professional misconduct in all these 6 A's, the 5 F's, and the single I that we learn in medical school, according to Bernard Knight. All of them are spoken of in this novel. And recently I came across another article, The 7 Sins of Medicine. I think all of us are guilty of either one of them every day. Obscurity, not being precise. We try to do a slipshod job. We try to evade from certain things. We try to hide things from ourselves, our physicians, and our peers, our patients. The cruelty to patients as well as cruelty to our juniors. Bad manners, bad bedside manners, over-specialization. We long for the rare, that's called spainophilia. And we have the common stupidity. And most importantly, our sloth, laziness. So, Manson tells this at the end. I know I have made plenty of mistakes. This is in the last chapter. I know that I have made plenty of mistakes, bad mistakes and practice. I regret them. Are we able to say, I'm sorry for what has happened. I want to rectify that. Again, from the two religions, you read what is there. And I'm reminded of Maimonides' famous prayer. He says, Lord, grant me the courage to realize my daily mistakes, my day-to-day mistakes, that from tomorrow I will be able to see and understand in a better light what I could not see or comprehend in the dim light. So ultimately with Manson's speech, and also from this book, what came about were two important documents in medical education. The Good Enough Committee report for medical schools, which actually pushed the NHS to make mandatory an internship, which we all of us undergo these days. And also about postgraduate education, this Todd report, which said that there should be a board that is responsible in determining the training, the teaching, and recommending for specialized care. Ultimately, I'm reminded of these two, that it's a city that is set on a hill that cannot be hid. We are called upon to be like that and to give light to all over in a dark and weary world. Shakespeare in Merchant of Venice says, how far that little candle throws his beams, so shines a good deed, a simple good deed in a naughty world. Thank you.
Thank you very much, Shehan, for that thought-provoking presentation out of this book, The Citadel. Would like to have comments, questions, to have a discussion on this. If anybody wants to comment or raise a question, mics are here if you want.
Shehan, thank you very much for that thought-provoking lecture. I read this book, not the whole book, probably a bridge version of this book when I entered the medical school. It was given as a gift by one of my teachers. Maybe that during that time it was okay, but can you remember this doctor tells this, that the goose who lays the eggs, the woman who comes with a lot of what we call the psychosomatic symptoms. And ultimately it tells you have nothing, you don't have any illness, just go away. Maybe during that time it is okay. But now we look at her and think what she has, whether there's some sort of psychological element, psychosocial element, or some psychiatric illness, depression, loneliness in her life. And we try to address that. What do you think about that episode?
Yes, sir. I think I can remember that incident in the novel. I think what was the incident before that was, I think he was encountered with some kind of injustice, and then he realized that what he was doing was actually not ethical or moral. I think that's the time when, if I can remember, that's the time when he referred a patient to a surgeon, an abortionist actually, who was working as a surgeon. He operated on one of his good friends, and the man dies on table. And that particular surgeon tries to cover it up by saying, look here, this was a death which could not be prevented. And then he tries to, hush Manson. And Manson becomes, the protagonist becomes very, very annoyed with that, and then he blasts at that person, and then he comes. With that anger, with that feeling of disgust, he comes back, and then I think he acts upon this patient. I think again that fact about the equanimity, Upekka, comes into my thoughts. Most of the time when we are in practice, the incident just before that has a ripple effect on the next patient. Let's say you get a call from somebody, maybe it might be another patient, maybe it's your trainee, maybe it's your wife. right? Who calls and tells, okay, do something, bring this or that, and then you get annoyed. But then you have this sort of maybe that anger, that uncomfortable state, and then you have that cast upon that next person. That happened on that patient. Yes, what you're saying is true. Somebody come with somatic symptoms, we should not just shun it off. Actually, in the book, they use the word neurotic. I think your wife is there who can give us a good interpretation of the word neurotic, whether it is derogatory or not, right? We know there's a difference between psychotic and neurotic, and I was asking questions in the morning from my psychiatry friends. And they said, no, you can use that word, but it's not a good word. So we have in all our practice, in all our, maybe government sector, private sector, wherever, yet even at home, we have patients who have this, illnesses which are beyond the body, the mind. But then again, I think the approach should be, we have to tell, okay, I understand your feeling. You don't have a physical illness, but your symptoms are real. But I will try to help. I don't know whether you will agree with, both of you will agree.
Agreed.
Shehan, congratulations on your excellent presentation. I was thinking, Cronin wrote this book almost 90 years ago. He has gone to extremes in views of this thinking mind. In fact, one wonders whether all the doctors of that time had the wandering, confused mind that he expresses brilliantly. Do you think that the situation, the world situation in this connection today is even worse than 1935?
Okay, sir, I think it is of the same level, maybe in a different perspective. The fact that medical practice, medical profession has changed, at least we have a set of guidelines or codes or whatever you may call it, which are there in a written form. So we may be having all these things in abstract thought, abstract expressions in our, ideal mind. I do have it, but the question is, do I practice it day in and day out? I don't. I'm guilty of that. Every day I do make a error of judgment. I go beyond what I should not have done. And I think, yes, coming from a different generation, I think about 2 generations after you, yes, I think the situation is still the same and it's going on. But I guess the mechanisms for discussion and mechanisms of, relieving those things are a little bit more advanced and more effective. But they are again confronted by various forces. May it be political, may it be economical, may it be administrative. I don't know whether I have answered your question, whether you see a perspective from your side.
Thank you. I see your point of view. Maybe it's a little different, maybe in the shading, coloring, and the picture.
Yes.
But nevertheless, it's almost the variety of the human being as against all other animals. Thank you.
Thank you, sir.
Shehan, just a suggestion. Thank you for your excellent talk, and I think as when you started your talk, you said Professor Senaka Rajapaksa suggested you to read this, and I'm sure it made an influence in you, and it did in me too when I read it first as a medical student. I think all medical students should read this book. I think there should be some way to make this not as only suggestion, even compulsory.
Thank you, sir. In fact, I have portions of this being used in, because I'm actually a chairperson of the personality and professional development stream, and I have incorporated certain areas of this book in the sessions that I do on empathy as well as professionalism instill. Going beyond, I suppose, in the same note, we have to teach our medical students as well as our junior doctors about the equanimity, being composed. Something which I tell my students, I don't have this, and that's how I start off with, and then we have a session. It's not a lecture; it's just a discussion that it goes on. Thank you, sir. Definitely, this will be more and more strengthened. At least at Jadpur, I think. There are people from the Colombo University also. I think they would also agree with all these thoughts.
Shehan, in your talk, you mentioned Philip Veerasingham. Do you know him? Does he still live? And have you read his book?
Yes, sir. I have read 2 of his books. I'm delighted that it talks about certain people from my family, with mentioning of the same sort of resemblance of height. Yes, and it is indeed a very interesting and a very thought-provoking series of books that he has written. Right, I'm yet to read. I think there's one on this devil bird by him. Yeah, Cries of a Devil Bird, if I can remember. But then again, there's ones about the medical career, the school, and then his life in Jaffna. Yes.
I thought of his book, the autobiography about the devil, using the devil bird, and also his reference to cutting the Gordian knot. I thought that there is some parallel between Cronin's writing and Philip's writing. Is he still alive? Living in Navisavella?
Yes, he's still there.
Thank you very much.
Thank you.